Knock, knock. Hi, my name is Lindsay Keating. I'm with the University of South Alabama College of Nursing, and I'm here to place an IV today, if that's okay. So the first thing I'm going to do is I'm going to verify the order, and I do see that you need an IV placed, and I'm going to verify the hospital's policy. So can I see your wrist? So I'm going to do my 2 patient identifiers. So your name is Jaguar Jones. Jaguar Jones. Your date of birth is 8/25/1963, 8/25/1963. Your medical record number is 417-6352, 417-6352, and I see that you are allergic to penicillin. Is that correct?
Correct.
Awesome. So now what I'm going to do is I'm going to go ahead and set up my IV kit. So I'm going to position my trash can. Perform hand hygiene. I am going to raise the bed to a working height, lower the side rails, and I'm going to position the patient comfortably in a supine or sitting position, maintaining privacy. And now with sterile technique, I'm going to open up all my equipment, but before I do that, I am going to show you what equipment I have today. So I have my IV extension kit. I have my normal saline syringe. I have my Tegaderm. I have my over-the-needle catheter. I have my chlorhexidine. I have an alcohol swab. And I also have a label for my IV. And this will be my sharps container today. So now what I'm going to do is I'm going to open my sterile packages using sterile technique and maintaining the sterility of all the equipment. So the first thing I'm going to open up is the IV extension kit. So now that I have opened it up, I'm going to take an alcohol swab and I'm going to clean the cap of, the injection cap with an alcohol swab. Now that I have done that, I'm going to take my normal saline syringe and uncap it. And I'm going to place it onto my injection cap and prime my tubing. Go ahead and prime my tubing. Now that I have done that, I'm going to go ahead and set it down on top of my package, maintaining sterility. And now I'm going to open my Tegaderm. Let's get that ready. Now I'm going to open my over-the-needle catheter. And now I am ready to position my tourniquet on my patient. So now I'm going to show you how to position the tourniquet onto my patient. So the first thing I would do is I would check the radial pulse. I feel for the radial pulse, and now I'm going to apply my tourniquet 4 to 6 inches above the selected site. And now that I have placed my tourniquet 4 to 6 inches above the selected site, I'm going to assess the vein for appropriateness. And now I'm going to perform hand hygiene again and apply my clean gloves. And I have applied my clean gloves. So now I'm going to take my chlorhexidine swab and I'm going to clean the site. For the chlorhexidine swab, I'm going to use friction horizontally, vertically, and in circular motions for at least 30 seconds. And now I'm going to allow the site to dry completely, and I'm not going to touch it. So now that I have cleaned my patient with chlorhexidine and applied my tourniquet 4 to 6 inches above the injection site, I'm going to proceed with my venipuncture. So what I'm going to do is I'm going to make sure that my bevel is up, and I'm going to angle it at a 10 to 30 degree angle. I'm going to tell my patient to remain still, and it's just going to be a quick pinch, and I'm going to hold their skin taut. I'm going to go ahead and inject. And now that I have injected, I see that I have blood return, and I'm going to advance it 1/4. And I'm going to go ahead and advance the catheter all the way to the hub. And now that I have done that, I'm going to make sure that my catheter is stable, and I'm going to pop off my tourniquet, and I'm going to hold pressure 1 1/4 inch above the catheter. Remove my stylet and immediately place it into the sharps container. Now I'm going to remove the cap off of my tubing, and I'm going to place my tubing onto my catheter. Now that I have done that, I'm going to access for blood return. Now I'm going to flush the syringe, and now I'm going to flush my syringe. And now that I have done that, I'm going to go ahead and place I'm going to place my tape to stabilize it right on below the hub. And while I'm doing this, while I flushed my syringe, I observed for any sites for swelling. And now that I've done that, I'm going to remove my syringe and place it into the sharps container. After I have done that, I'm going to take my transparent dressing and I'm going to apply it to the hub of the catheter. And I'm going to leave the connection below the extension to set up a hub and uncover without touching under the dressing. And now I'm going to place it over the hub, the catheter. And now that I have done this and disposed of my equipment properly, I'm going to make sure that it is stable. See my tape, here we go. So I'm going to secure my IV and IV tubing now, and I'm not going to place the tape under or over the transparent dressing. I'm going to allow the saline lock tubing to assume a natural position prior to taping. About the natural position, so I'm going to tape it. And now that I have done this, I've properly secured my IV. And so now I'm going to dispose of any equipment safely and properly remove and dispose of my clean gloves, but I would just say that I'm going to do that because I'm going to show you how I would discontinue an IV saline lock later on in this video. But after I have done this, I'd write the date, time, gauge, and initials on a tape label before applying to the edge of my dressing. I would reposition my patient for comfort and safety, lower the bed lower the bed and raise the side rails. I would instruct the patient on how to prevent dislodging the IV and the signs and symptoms of IV complications, which could be infiltration, phlebitis, inflammation, and to see if there is any leaking around the tubing site or blood around the tubing site. After I have done all of that and have performed my hand hygiene, I would place my gloves back on. Actually, before I would perform hand hygiene, and then I would go document. I would state the date, time, I would describe the location, the number of temps, the catheter gauge, and the length, and the patient's tolerance, the presence of the saline lock or flow rate, and the method of infusion if fluids are prescribed. So now I have gone back into the patient's room. I performed my hand hygiene, applied my clean gloves, and now I'm going to show you how I would discontinue the IV saline lock by demonstrating principles of asepsis, homeostasis, and I'm going to dispose of my equipment properly, and then I would document after I am done. So to discontinue the IV saline lock, I'm going to take off, I'm going to hold pressure, I'm going to undo all my tubing that I had on it, and I'm going to hold pressure. I'm going to actually remove the tape first. That is holding my tubing. Dispose of it. And now I would hold pressure 1/4 above my catheter, and I'm going to go ahead and remove my tegaderm. Now that I have removed my tegaderm, I'm going to go ahead and dislodge the IV. But what I'm going to do is I'm going to take my gauze and I'm going to hold pressure, and I'm going to go ahead and remove it, place it into the sharps container, and make sure my patient, I would put some tape on over it, make sure that they're okay. And then after I have done so and discontinue my IV saline lock, I am going to dispose of my clean gloves, and I would perform hand hygiene, and then I'd correctly document discontinuing the IV saline lock.